Dr. Richter. So today we are going to do a Q&A with you. My name is Maddie Lackey, and I am a regenerative medicine consultant with Transcend Biologics. So we just kind of want to learn a little bit more about your practice and how regenerative medicine fits inside of your practice.
Sounds great.
So for veterinarians who may not know your work, can you briefly share your background and how you became interested in regenerative medicine?
Sure. Obviously I'm a veterinarian. I've been a veterinarian in the San Francisco Bay Area for going on about 28 years, plus or minus. During most of that time, I've been practicing integrative medicine. My current practice, holistic veterinary care, we offer both Western medical care and also alternative medicine. So that might mean acupuncture, chiropractic, herbal therapy, but it can also mean things like hyperbaric oxygen, ozone therapy, regenerative medicine. To me, the way I approach medicine is I will consider any therapeutic modality that has scientific basis behind it for safety and efficacy. So, I kind of learned a long time ago that what they teach you in veterinary school is really just sort of the foundation of where one can go in medical practice. And it has created a really sort of unique niche for me professionally. And also it makes professional life really, really interesting and fascinating as well, because there's always new things to learn, always new things to find. And to me, that's where regenerative medicine sits. It's such a cutting edge technology that is, it's always changing, it's always growing. Now we're looking at regenerative medicine through the lens of longevity science, which is really something that's even more fascinating. That's probably a fairly long-winded answer to your question, but that's how I got here.
And for veterinarians who are new to the concept of regenerative medicine, how would you explain it and kind of how PRP fits within it?
Sure. So, I mean, the way I look at the way I look at Western medicine is with a couple of notable exceptions. Western medicine is very, very good at sort of treating symptoms. You treat for pain, you treat for inflammation. You don't always wind up treating the root cause of a problem. That's actually one of the reasons I got into alternative care, is because in many cases, alternative care is really more about treating the root problem or supporting your patient as a whole organism, to allow that organism to heal in and of itself. So regenerative medicine really, really sits in that space of, rather than cover up the inflammation but don't do anything, for example, about the osteoarthritis itself. Let's actually get to the cause of the OA, and improve that scenario. So that way there's less pain and inflammation because, in this example, because the joint is actually healthier and functions better than it used to.
Yeah. So, kind of to play off of that a little bit, how does the platelet-rich plasma itself kind of support that healing and make the joint better than it was before, and any other applications as well?
Sure. So, I mean, as any medical professional would know, there's all kinds of healing factors that sit within the plasma. So, it's platelets and it's fibrin and other factors within the plasma that allow the body to heal. I mean, that's how we heal when we're injured. Um, when you wind up having, again, say a damaged joint, damaged cartilage surface, osteoarthritis, the body doesn't really do a very good job of managing that situation. And in fact, when I was in vet school, we were taught once the cartilage is damaged or worn, then that's it. There's nothing else you can do other than manage the pain. And the reality is that's not completely true. We don't really have the ability to kind of make the joint perfect again, but we do have the ability to dramatically improve that cartilage surface, improve the condition of the joint capsule itself, and those healing factors that are in that platelet-rich plasma wind up being, a significant part of that. In so much as that when we put those factors directly into a joint, they get to work on the cartilage, on the joint capsule, and really addressing the inflammation that is happening within the joint to improve that joint environment over time.
And for your typical small animal practice, what are kind of the top conditions that you see where PRP has become a go-to tool for you?
I mean, the top things that we see, and my practice, like I say, we're very integrative. We do a lot of physical rehabilitation, so we see a lot of older animals with arthritis. We see animals that are cruciate ligament damage, either with or without surgery. Various other types of injuries, hyperextension injuries, like a carpal hyperextension injury, things of that nature, all of which are going to cause inflammation, pain, lameness, and ultimately all kinds of chronic problems. So, from a PRP perspective, that's a lot of what we're using it for. Now, I think it's worth saying there's other things that one can use PRP for, particularly things like wound care, things of that nature. In my office, we have a lot of modalities that we use for those sorts of things: hyperbaric oxygen, ozone, regenerative laser, etc. So it winds up becoming integrated into a much more comprehensive treatment plan when we're talking about those kinds of things.
Okay. And then are there any cases that you've seen where PRP has been able to help where it would have normally not had a similar outcome?
Yeah, again, like I think like every veterinarian, we see a lot of older animals with osteoarthritis. We see a lot of animals that are on the standard of care, if you will. So they're on a non-steroidal anti-inflammatory. Maybe they're on gabapentin, although arguably gabapentin probably doesn't do a whole lot for pain anyway, but it's kind of standard of care anyhow. They're on some sort of joint support supplement, whether it be glucosamine or UC2 collagen. If their veterinarians sort of really on top of things, they're on a product like Adequan, like a polysulfated glycosaminoglycan that's given injectively. Um, all of that stuff is great and in many cases effective, but in a lot of cases also it just isn't getting us where we would ultimately like to be. That animal's still in pain, they're still lame, they're still having trouble. And that's when you really have to start looking elsewhere. And at least in this practice, we've found a lot of application for intra-articular PRP. We've found that it can be really, really helpful for these guys.
And you kind of spoke about this a little bit when you were talking about wound care, but what are some other treatments like surgery, rehabilitation? You spoke about that as well, or anti-inflammatory medications where you can kind of use PRP as an addition to those treatments.
Yeah, I mean, as I was saying, I mean, PRP is it's one of these compounds that really, really can promote healing. From a again, so like from a post-surgical perspective, if we have if there's a patient that's either it's been a very traumatic surgery or they're slow to heal, PRP could be used to help speed the healing of that. Slow to heal surgical wounds, for example, is another really good example. Wounds that maybe either because there was a lot of tension on the suture line or because of the nature of what the wound was, they were sort of left to granulate in by second intention. That's a good way to really promote the formation of that granulation tissue and speed that healing process along.
And then you kind of spoke about how some of our older patients tend to be the go-tos for PRP. What
Yeah.
types of patients tend to respond the best to PRP?
I mean, I think at least here, the ones that we see do the best are the ones that I would say have, sort of classic osteoarthritis signs. So, maybe they injured a cruciate ligament years before and now they're arthritic, or, they've got a bad shoulder or an elbow, whatever, pick your joint, etc. I think the sort of the wild cards here are, do they have some other complicating factor? So, for example, if we're talking about a dog that has elbow OA, do they also concurrently have a joint mouse? Is there some physical object floating around in that joint space? Because if there is, then that's going to continue to cause pain no matter what you do until you remove the thing. So, do they have some kind of, complicating comorbidity? But if they don't, and it's, what one might call sort of garden variety osteoarthritis, those guys tend to respond very, very well. Now, I think it's fair to say that nothing works in everybody, and sometimes we'll treat these guys and we don't get the dramatic response that we were hoping for. That's just medicine. There's just a certain unpredictability in some of these things. But the nice thing about it is that because you're giving the patient their own biological material. So, like, other than doing an appropriate aseptic prep for a joint injection, there's effectively very, very little chance of there being any downside to this. I mean, I think your worst case scenario with most of these animals is it doesn't work. You don't have a lot to lose.
And we've kind of talked a little bit about what PRP is and how it's used. What would be your advice to any vets who are wanting to start doing PRP in their practices and they're just getting started?
I think the advice I would give is number one, give some real thought to what are your current protocols for these kinds of cases, because you want to make sure that you're checking all of the appropriate boxes. I mean, as is always the case in medicine, we want to do the least invasive thing first, and work our way down that road. So like for me, it's, as these animals come in, we would make sure that they're on the appropriate joint support supplements. We would put them on Adequan. Then we're going to talk about an NSAID or some other kind of pharmaceutical anti-inflammatory or pain reliever. We've had some success with periodic injections of low dose ketamine for pain control. So, like, check all these boxes, and I mean, if you can fix this without having to do a joint injection, great. But unfortunately, the reality is with arthritis, and this is true for an animal as it is for a person, generally speaking, this process only goes in one direction. It just slowly gets worse over time. So even if things have been controlled well for a little while, eventually you might get to a point where it's not working anymore, and that's where you need to start looking at things like PRP. So to your question, like, as a veterinarian who may be thinking about this kind of process, number one, like I say, make sure that you're doing all the other stuff first. Number two, really make sure that you are comfortable with the joint injection process. In all honesty, it is not rocket science. Most joints are fairly easy to get into. The one joint that I think it can be very challenging, are hip joints. And that is in part because there is a lot of muscle and fat to get down to the hip joint. And needless to say, when you're talking about an arthritic joint, you're not really talking about a normal joint space anyway. So it can be very challenging to get into a hip joint. And quite frankly, I don't frequently do them because they are tough to get into. But a knee, an elbow, a shoulder, a carpus, a tarsal joint. It's not that hard. Like with a little bit of training, any veterinarian can do this. And if as a practitioner, if your goal both sort of medically and professionally is you want to be able to offer something that is number one gonna have a really good potential for making a positive difference in these animals, and number two, from just from the standpoint of you want to be able to offer something that probably not too many other people in town are able to offer. This is a really good thing to do. And quite frankly, like, from a barrier to entry perspective, this is not the kind of thing where you have to buy $50,000 worth of equipment to do. I mean, there are other, I mean, like, you want to put a hyperbaric oxygen chamber in your office, that's going to cost you probably 150 grand by the time you're done. That's a big return on investment calculation. This is really easy because you don't have to buy anything other than the disposables that you're going to use. So in that sense, it costs you nothing to get in.
And then from a pet parent perspective, whenever you're having a conversation with a potential pet parent that might be a good candidate for PRP, how do you kind of
Mhm.
explain that? And sorry, my computer just fell asleep. How do you kind of explain that and help them understand the value of doing PRP?
Sure. You know what? I explain it in much the same way we just talked about it, which is most of the things that we're able to do, in veterinary medicine when it comes to things like osteoarthritis, we're treating symptoms, we're treating pain, we're treating inflammation, which is fine. But I think we just need to understand it for what it is, that we're not doing anything to change the course of the progression of the joint. I think the exceptions to that would be glucosamine, UC2 collagen, and adequan. Probably the three things that might actually make a difference as far as the joint environment goes. So I will explain that to people, and really just point out to them that, look, this is what we're doing now. We're not we're not at an ideal place. Your dog is still painful, still limping, still having some trouble, and we would really like to do everything that we can to make them as comfortable and functional as possible. There's always the understanding that, like I said before, like not everything works as well as we'd like it to, and nobody's curing arthritis. So it's not that, but if we're looking for what else can we do that's going to make a positive difference, this is a really good thing to do. Um, as I said, it's very, very safe as a procedure, and in the grand scheme of things, it's not that expensive.
So this has kind of been where PRP and regenerative medicine is now. Where do you see it in the next 5 to 10 years?
Yeah. So the next 5 to 10 years is going to get interesting. So I'll tell you right now, and this is a thing that can be done right now, and we do this in my office a little bit. You can combine stem cell injections into a joint with PRP. Now, stem cells, that's a it's a sort of a very different process from the standpoint of your cost, client cost, relative invasiveness of getting all this done. But even now, like you can do that. You can combine stem cells and PRP, and I think get very good results. Moving forward, I think where where we're going from a regenerative medicine perspective is I think we're going to be finding more and more compounds um, that are going to help that joint surface heal. So for example, even now, one of the other things that will often combine with PRP is an osteo cushion product. So there's a product out there called Spring, which is an osteo cushion product. So it does exactly what it sounds like. It creates a barrier within the joint that creates some separation between the cartilage. Um, those injections will last, depending on the dog, between 6 and 12 months. So, if now you can put an osteo cushion product in there to reduce the friction and the PRP in there to improve the healing, now you've really, now you've really done something very interesting from the standpoint of keeping these guys comfortable. So that's available now. I think you're going to see more and more products come out over time that are going to promote healing. Some of these may be, again, things that get injected in the joint. Some of them maybe external treatments. We're already seeing things like regenerative laser, therapeutic ultrasound, shockwave, things of that nature that are very beneficial. I think it's sky's the limit as far as the technology that comes down the road. We may get to the point where, we're talking about either gene therapy, um, or a whole new type of stem cell process that is able to literally target, for example, cartilage cells in the joint. So there's a lot to come. I mean, if anybody has been sort of paying attention out there, the whole field of longevity science is just absolutely exploding in the research scene, and there's so much money being thrown at it research-wise, that I think there's a really, really great chance that we're going to see a lot of real interesting products come out soon.
And then can you share a memorable case where PRP has made a meaningful difference within one of your patients?
Yeah, absolutely. I mean, I have a an older Labrador that we see a lot of patients here sort of on an ongoing basis because of the physical therapy and acupuncture and things like that. So it's not uncommon for us to see patients a couple times a month. Um, so the good news about that, other than the treatment, is you get a lot of really nice check-ins with the owner, so you find out how things are going. So we have this geriatric Labrador patient that I was doing acupuncture on a week or two, and I was just talking to her about how things are going. The dog he has a very arthritic knee, and he's also got a similarly bad elbow. So we injected PRP and Spring into his joints, I think about 3 or 4 months ago now. And she was telling me that there was just such a dramatic difference in his comfort level from the standpoint of like how quickly he gets up in the morning and how long he wants to go out for walks. And just what you might think of as like really mundane day-to-day stuff. But I mean, honestly, like anybody who has any degree of chronic pain will tell you that it's the mundane day-to-day stuff that you really start to appreciate. The fact that you can get out of bed without pain, the fact that you can get in and out of your car without pain, things of that nature. And that's essentially what this lady was describing to me. And it's, and we're doing all the other stuff with this dog. I mean, it's not, I mean, rarely is any patient treated with one modality. But we were doing all the other stuff before we did the joint injections in this dog, and he was doing okay, and now he's doing really okay. So that's always really gratifying to know that you made a difference, in that pet's life. And like I say, I mean, again, from a procedural perspective, it's just not that hard to do.
Yeah, it really helps that quality, day-to-day quality of life.
It
That's where you
does.
see the big difference.
Yeah.
And then kind of with all of your experience, how would you use that to recommend vets kind of have characteristics to evaluate within their clinics to kind of see if what PRP system would be the best for them?
Yeah, I mean, as you well know, I mean, there's a lot of options out there. And for me, uh, it's sort of like the calculation of like what you're going to look for. I think it really comes down to sort of factors like what's effective, ease of use, and quite frankly, what does it cost? I mean, because ultimately the cost of that PRP system is going to wind up getting passed along to the pet owner. And it's going to make a difference in not only sort of what the profit to the clinic is, but also from the standpoint of the compliance with the owner. I mean, if it costs too much money, it's going to get hard to get people to agree to do it. And honestly, like that's always a really disappointing thing a little bit about veterinary medicine is that so frequently treatment decisions are made on cost, but you know, that's the reality. I will say that it has been my experience that in general, pet insurance does cover this kind of stuff. I always tell clients to check their policy and make sure because I don't ever want to promise anybody anything when it comes to insurance. But that said, in general, they usually pay. So that's a plus. So anyway, you know, does it work? How much does it cost? What's the ease of use? I mean, I think those are really sort of the three factors when you're looking at like what, in this case, what PRP system should I look at?
And kind of, we have talked about the future of PRP and regenerative medicine. Um, do you believe that regenerative medicine and kind of PRP and all those other factors or systems are more where veterinary medicine is heading?
I think that's more where medicine is heading, period. Um, I wrote a couple of books a few years ago, Longevity for Dogs and Longevity for Cats, and I did that because I wanted people to really get a window into where we are longevity science wise and like what you as a pet owner can do now and what to look for in the future. As far as how to help animals. And yeah, I mean, I think the deeper that we dig into this, into regenerative medicine and longevity science, the more ways that we are going to find to stimulate the body to heal. Um, Treating symptoms is fine, and I know I don't want to disparage it at all because sometimes that's all you've got. But I think anybody would agree, and you don't need a degree in medicine to have an opinion on this. Like, if you had an option to cover up the pain with a pharmaceutical or treat the source of the pain so there's no more pain to begin with, like I think we would all know which is the better of those options. And it's not a black and white thing, and I think it's going to be a long time before people will look at nonsteroidal anti-inflammatory drugs and say, well, those are completely obsolete. We're a long way from that. But that's where the science and the research is looking, is like, how do we regenerate a joint so it's just not arthritic anymore? And that way there is no more pain. That's where this is all going eventually.
With everything we've talked about today, are there any last words or any specific things that you didn't get to say that you would like to talk about?
Um, I mean, I think we've talked a lot about PRP. I mean, I think the other thing that I would just say to veterinary practitioners is um, keep an open mind towards stuff. Realize that as veterinary professionals, we sit in this very interesting space that unlike our counterparts in human medicine, we have dramatically more leeway to offer treatments than a physician would in human medicine. Um, partially because of liability issues and partially because of just the box that physicians are put in as far as what they are and are not allowed to do. We have way more leeway in veterinary medicine to do things to help our patients, which is great news. The other side of that coin is it puts the burden on us as the practitioner to do our due diligence to know that the thing that we're going to offer is number one, safe, and number two, has a good chance of being effective. And as I said when we started this conversation, I mean, as a practitioner, I'm always looking for new treatment modalities that have good scientific basis for efficacy and a good safety profile. And if I can check those boxes and that treatment modality is available, whether it's a hands-on therapy or something that's taken orally or whatever it may be, um, you know, that's a real gift that we as veterinary practitioners get to use. So, what I often tell veterinary students or like pre-vet students when I talk to them, as I tell them that as a medical professional, above all else, you need to be a lifelong learner. You need to be the kind of person that's always looking to learn something new. The running joke is there's a reason why they call it medical practice, because none of us ever really get it right. And both from the standpoint of the benefit of your patients, but also quite frankly from your own personal satisfaction and professional enjoyment. If you're learning new things and doing better by your patients than you were, say, last year or 5 years ago, then that's a really, really nice place to be. That keeps you happy in here, and it keeps your clients coming back. So it's win-win.
Excellent. I think that pretty much covers it. Thank you so much for talking with us today. We really appreciate it.
You bet.